Okay, now we're going to talk a little bit about health benefits. Okay, when you talk about benefits of your health insurance program, they can get kind of complicated. Notice this chart here tells us all of the details of Brady Adams' health insurance. It tells us his deductible for him individually. Um, Deductible means the amount that you have to pay before your insurance starts helping you out. Okay, that's what a deductible is. So that's the amount you pay before insurance starts paying part of your bills. Notice there's a network and a non-network. A lot of insurance companies have a group of doctors and hospitals that they work with, and so you get better rates there. So notice if it's non-network work, it's $1,600 for a family. If you're in the network, it's only $750. Now we're going to assume in this question that all of the work he had done was in network, so we're only going to work with this part of the chart right here. We're going to assume that he stayed within the network to save some money and work with his insurance company. Hospital charges. Okay, so for the hospital, his insurance will pay 80% of that. For home health care, the first 50 visits, his insurance company covers all of it. But if you have more than 50 visits, they only cover 80%. Physician's visits, he has to pay $15 every time. Specialists, he pays $30 each time he visits a specialist. For physical therapy, the first 15 visits are $15, and if he goes over that amount, then they'll cover 85% of the full cost. For the ER, they'll pay $55, and for the ambulance, he pays $20. Okay, so these are the amount he pays. When it's percentages like this, that's the percent that the insurance company is covering. So let's take a look at his charges here. Now, if we want to know how much the patient pays altogether, we start with the deductible, because you have to pay the deductible before your insurance kicks in. Okay, then we have any co-payments, because again, those are not covered by the insurance company. It gives you a lower rate that you're paying for visits, but you pay those out of your pocket. Plus the co-insurance amount. So this is the percentage when on these parts where it says his insurance is covering percentage of everything. This is the percentage that's left over for him to pay. And then plus hospital charges. Okay, so any admission fees, which here it says that they'll pay 80% of that. Okay, so we're going to start calculating, and keep in mind, this is not exactly the way they do the one in the book, but this is the way they calculate the one that you're asked to answer. So we're going to start from the top, and we're going to work our way down. So first thing, he has to pay his deductible, and his deductible for a single person is $275. So that amount I can go ahead and fill in. Next, we're supposed to add the co-payments. So anything there's a co-payment for. So notice here we have all of these items here: physician's visits, specialists, physical therapy, other visits, ER and ambulance if you were to have those. So let's start up here. So it says he has a co-payment for 8 physician visits. Okay, so I'm going to put our co-payments down here as we calculate them. So 8 physician's visits, that would be 8 times $15 per visit. Okay, so $120 for that. Right, next he had 20 specialist visits. So specialists he has to pay $30 for that. So we go 20 visits at $30 a piece. So $600 for his specialist visits. Right, what's next? Following the surgery, he made co-payments against more co-payments for 15 physical therapy visits. For 15 physical therapy visits, well, the first 15 are $15, and that's all that he had were 15. So those are going to be $15 a piece. So 15 visits at $15 a piece gives us $225 for the physical therapy. And he had 7 visits from a home health care nurse. They were $65 a piece. So this is kind of a co-insurance because see, where's our home health care? It's right here. It says the first 50 visits are covered 100%. Anything over 50, they only cover 80%. So what percent is left for him to pay? Well, 100 minus 80 would be 20%. So for those home health visits, he made 70. Okay, well, he only is covered fully for the first 50, so how many are left? Well, 70 minus the 50 is covered for, leaves him with 20 that he has to pay 20% of. Okay, so let's do the home health visits. Those are 20 visits because he had 70 and he only got help with 100% with the first 50, so that left him 20. Okay, he pays 20% of that, so we take that times 0.2, and then we take that times the price of each visit. Now each visit cost him $65. Okay, so we're going to take 20, the number of visits he has to pay a percentage on, times 0.2, the percentage he has to pay, times 65, the cost of each visit. And that leaves us with $260. Okay, let's see what else it has. The hospital admission charge was $250, and the hospital bill was $16,052. Okay, let's stop right here and total these, because these are our kind of our co-payments that we have here. So we had the $120, the $600, the $225, and the $260. That gives us a total so far of $1,205. I'm going to go ahead and put that up here. Okay, so again, we went ahead and found out what he owed on each thing. We've done everything except for the admission charge and the hospital visits. Now, in your book, the example they gave, the person had to pay the full amount of the admissions charge, but in this example that they're having you answer for credit, they only had to pay a percentage. Okay, so let's take a look at what percentage that would be. For hospital charges, they cover 80%, which leaves what percent for him to pay? Well, 100 minus 80 gives us 20%. So he is paying 20% of the $250, and he's paying 20% of the $16,052. So let's find out what that co-insurance amount is. So co-insurance amount for the hospital bill is 20%, again, because they cover 80, and that leaves 20% for him to pay. 20% of 16,052. So we take 0.2 times 16,052. Okay, so for the hospital bill, he's going to owe $3,210.40 plus the hospital admission charge. Now again, in the book, they have them paying the full amount, but in the question they have you answer, you're only paying the percentage that you owe for hospital charges. So you owe 20% of the $250 admission fee. So $50. Now we can find out what amount he paid by adding all of these together, the deductible, the co-payments, the co-insurance, and the hospital charges that he had to pay. So $275, $1,205, $3,210.40, and $50. Okay, and he ends up paying $4,740.40. Okay, so you can see it did save him a lot of money. Okay, he didn't have to pay the full $16,000. He also got some discounts with these co-payments, but he did still have to pay $4,740.40.